Hey, I'm CP, a physical therapist here in Austin, Texas. Been talking to you guys a lot about posture, and the latest and greatest we've been doing is mobility assessment, flexibility. How can you tell if you're restricted or you have issues with joint mobility or muscle flexibility that may limit your range of motion? One of the series we're going to talk about today is the hamstring. So I'm going to show you an assessment for the hamstring, one of my favorite ways to sort of look and make sure that you've got adequate hamstring length, and then a couple of ways that you can either stretch it or mobilize it. So first thing I'm going to do is this is called a 90-90 hamstring test. This is something I use in the clinic a lot for like my soccer players who might be having issues with striking a soccer ball, or even for you guys who maybe aren't athletes. Remember that tight hamstrings, especially if you sit all day, can create low back pain, knee pain. These hamstrings are major force producers, which means if they're short and tight, they're going to create a lot of tension and stress around the joints that they attach, which happens to be the knee and the pelvis. So in this position for 90-90, what I'm going to have Lucy do is I'm going to bring her up here. Now look at this angle right here. This is 90 degrees and this is 90 degrees, hence the name of the test. And now if you'll just grab your thigh, she's basically going to hold here. Remember, you don't want to pull it towards you. You don't want to push it away. It should just be perfectly perpendicular, 90 degrees. Okay. Then what I'm looking for is for her to activate using her quadricep muscle. She is going to activate and go into what's comfortable. You can see she gets some tension here now. Notice I'm leaving this foot alone. I want this to be flexed and loosey-goosey. I do not want you to pull it towards. That's actually uncomfortable for her because that turns and makes the nervous system go into tension. It does not like that. Remember, muscles like to be stretched, nerves do not. So leave this foot out of it or else you're gonna feel a lot of excessive calf stress and strain in this position. Remember, if you feel that calf stuff, that sensation in the calf in this position, that is the nervous system and you wanna back off a little bit. Okay, you should really be feeling the stretch in the hamstring. Okay, so she's in this position here. What is normal? Normal would be either at the vertical or slightly off the vertical, right? We give about 10 degrees of fudge. You won't know what that means, but just in general, like just kind of anything that's just slightly off the vertical. This is a little bit of tightness. Now I've got some people in the clinic that look like this. This is crazy. You need to work on this. This will create a lot of problems for you. So if you get here and you see this thing shaking and crazy, that means you need to spend some extra time and effort on your hamstring. So now that we sort of know where Lucy is in her flexibility, she's got some limitation, and so we want to address that. You can either mobilize the hamstring first and then come back to the stretch and recheck yourself, or you can try a little bit of the stretching first, then go mobilize and then come back and check yourself. What I want to do here is show you the actual stretch. She's going to, again, grab her thigh, hold it perpendicular. She actively uses the quadricep to bring this leg up until she feels tension. This should not be super uncomfortable, right? This should just be like, ooh, that is a stretch, and you should feel it in the back of the thigh. Again, if you feel it in the calf, back off just a smidge, and you're just gonna hold this here. You can hold 10 seconds, maybe 20 seconds. If you feel like you're getting a lot of tissue resistance, you can do what we call just baby little glides, little flossing, or she'll just take out of it a little bit, into the tension, out of the tension, into the tension. So again, you can hold 10 to 20 seconds, and you might want to repeat that maybe 2 to 3 times as you feel what's called creep occur, right? The hamstring's going to give you some, give it a little bit more, give it a little bit more. Because remember, with stretching, the body can perceive that as a threat, like you're about to do something it's not prepared to do. So it's nice, it's slow, it's controlled, and it should, again, not be painful. Just feel restricted, tight, okay? Okay, Luce, let's see your other leg. Good, and then raise it up. About the same, still again, just a mild limitation. This should be fairly easy for her to clean up. And again, she can oscillate just a little bit. She can hold and repeat. I usually like to do one leg and then the other, then go back so it gets a little recovery. You kind of feel that there. When you oscillate, make sure again, you always get into the tension, out of the tension. And you can repeat that for like 10 seconds or 10 flosses, whatever you want to do. Good, and relax. So first thing we're gonna do to start with mobilization of the hamstring, remember I sort of like something like a foam roll where there's the big gross surface. You can just prep the tissue like, hey, I'm about to get in here and do something that's not super fun. So a foam roll is a nice way to start with that. So let's put it here in that hamstring muscle belly. Also this one you're gonna need a little bit of leverage. You need to get your body weight up so you can sort of start to prep some of that tissue. Remember the hamstring goes kind of to the knee and up to that sit bone that you have back there. So try to get anything and everything that you feel like needs to get prepped. And then once we're done with the foam roll, then I'm gonna have Lucy get in a little more specifically. Remember you can use like a tennis ball, a lacrosse ball. You can have the two that are taped together. I like the Mobo Duo because these points of contact can get in a little bit deeper. Also with Mobo, it can open up and spread these points of contact and you can adjust that however you want. So we're gonna start here. And again, this is gonna be a little bit more aggressive, right? Kind of like this was brushing your teeth, now we're flossing. We're getting into those muscle bellies, a little deeper into that tissue with these points of contact. Your body weight is what's creating some of that resistance and leverage that you can get in there. Good. Okay, so remember on the hamstrings, right? And even with Mobo Duo, it's in its wide setting. You don't want to get down into the tendons behind the knee, right? You've got a big vascular bundle. You've got a lot of blood vessels and nerves that travel there, so don't get up into the knee. And then certainly you don't want to get up into the pelvis where that sit bone is. You don't want to have pressure directly on that. Again, the sciatic nerve comes right out of there. So remember with hamstrings, stay in those muscle bellies and spend, I don't know, 20 to 30 seconds or so just sort of finding all the little areas that you feel like need to be managed with some of this deeper pressure. Okay, so now what we're gonna do is we went from the mat or the floor doing some hamstring mobilization. This is something you could actually do while you're seated. Say you're at work, or if you've been on a trip and you've been driving, this is something if you carried your tennis ball, your lacrosse ball, your Mobo with you, something you could do to kind of give those hamstrings some relief. Because remember, when you're sitting all day, this is gonna create some tension and shortening. So what I would have Lucy do is she puts it right up in that muscle belly. While you're seated, what you can do is do, again, some sort of flossing. You're just gonna straighten this leg out so that you get a pin and release, right? You get some pressure up into that hamstring, and then the hamstring gets to go through its lengthening phase and shortening phase while you're doing this. One thing I wanna caution you about is, remember, when you get this leg up here, do not, I repeat, do not pull this foot towards your face. You're gonna want to do that, but again, you're gonna create nerve tension and you don't want that. That's not the sensation we're looking for. All of this pressure should just be in the hamstring. One more word of caution is you don't wanna leave the ball here, so don't drive with it there because the sciatic nerve travels through there as well and it does not like compression. So your job is to like floss a little, move it, floss a little, move it. I, again, of course, want to use the Mobo Duo because now, again, I can sort of have 2 points of contact instead of one. I can also, again, change the distance that these balls are going to create contact to the hamstrings. They're a large muscle group, so I like to be able to tackle them a bunch of different ways. Again, place it under here, flossing, no foot action happening, and maybe you pick like 5 repetitions and then move your source of contact. One thing I want to remind you guys of is the nervous system is very particular with stretching, right? So even right here, you can see that Lucy goes into this and she gets some shaking. Shaking is it's a warning sign from the nervous system. It thinks, again, perceives a little bit of a threat. So you do not want to force any contraction or stretch through that shaking. That is the end of the line for it. You want to subtly make some changes. You don't want to force through any of that shaking. Remember, if you try to force a stretch, the brain actually will contract that muscle against you. It's called the stretch reflex, and it's going to try to protect you, and then you've just been counterproductive in what you're trying to do, right? We want flexibility, we want length in that muscle, and you will be counteracting that if you try to force the stretch. All right, so that's our hamstring assessment, the 90-90. That added the stretch. You can keep the 90-90 as the flexibility component, and then you have a couple of different ways to mobilize. You've got on the ground or on a chair or some surface that you can get in there. and mobilize that tissue. So remember, I have some other assessment videos coming your way, so be looking for them, and we'll work on some more flexibility and mobility options for all of those areas you guys have restrictions in. Thanks for joining us today.
We at Wellness Plus specialize in all things health and wellness, ranging from yoga and fitness to massage and ASMR. Whether you are looking to target specific areas of tension or want to enhance your general self-care routine, we provide the tools you need to feel better, look better, and live better. We have courses for every level, whether you're just starting out or you're a seasoned pro. Our courses provide a wide range in difficulty to accommodate your evolving flow.
Welcome back to Yoga with Jess. We are going to break down some really essential postures.
We are going to rock out with some of the most essential ab exercises that you need to have the abs that you've always dreamed of.
I've blended techniques to help you connect with students, and you can be a rock star teacher.
Wellness Plus is available on your phone, tablet, or TV. Join Wellness Plus today and get your first 7 days free.